Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to leave any questions, suggestions, or feedback in the comments section below. Also, please feel free to like this video. You could visit my website, Championship Chiropractic, to get more information on the book and also to connect with me on my other social media sites. Please enjoy this sports medicine video. The topic of today's Dr. Ozello's Medicine Report is a knee condition called Pes Anserine Bursitis. The pain and symptoms are located right here. It is just distal and inferior to the patella. The patella is the kneecap. And if you go down about 2 or 3 inches and then you go over slightly, that's where the symptoms are at. Now, the Pes Anserine is an area where 3 of the thigh muscles attach to the tibia bone. The tibia is the big bone in the front of the lower leg. 3 of the muscles that start in the pelvis attach right down here. These muscles are the sartorius muscle, which starts in the front of the pelvis, the gracilis muscle, which is one of the groin muscles, and the semitendinosus, which is one of the hamstring muscles. And they all attach right here. 1, 2, and then 3. Right underneath them is a bursa. A bursa is a fluid-filled sac that helps to reduce friction. When there is tension, too much tension, that bursa sac can become inflamed. That's what bursitis is. Bursitis is an inflamed bursa sac. Now, this can be caused by several different things. It can be a traumatic onset where there is a direct trauma to this area. This can happen during any contact sport. This can happen during baseball. I've seen a ball player get hit right here and have inflammation of the bursa. This can also happen during an auto accident. Now, most of the time when I see this, though, it is not the direct trauma. It is an overtraining type of an injury, and that causes this area to become inflamed. When we have any type of non-contact overuse injury, there are 3 factors that are involved. It's too much training, inadequate rest between the training sessions, and some type of biomechanical fault. The Pes Anserine is nicknamed the Goosefoot because where 3 tendons attach to the tibia, because they are right on top of each other, it resembles the foot of a goose. So you may see that terminology or you may hear that. So I just wanted to let everybody know. Now, the intrinsic factors that can be causing this condition include knock knees, or what in medical terms what we call genu valgum, where the knees come inwards. There can also be weakness in the medial thigh muscles, weakness and tightness in the hamstring muscles. There can be a postural fault where the pelvis is tilted forward. Also, there can be weakness in a variety of muscles, of core muscles, that help to stabilize the pelvis. The things that we do outside of our bodies, the activities that we do, the extrinsic factors that contribute to Pes Anserine Bursitis include, like I mentioned, overtraining and inadequate rest between our training sessions. Multiple squatting, repetitive squatting, too much squatting. Okay, squats are a fantastic exercise, but we need to use a variety of stances and a variety of widths with our feet and a variety of just the way that we perform that exercise so we don't always target the muscles and put the stress on the joints in the same way over and over again. So you want to think about that whenever you are doing your exercises. Also, side-to-side motions. Many times when we're exercising, especially when we're outdoors, we are doing side-to-side motions. That puts a great deal of stress on the medial aspect of the knee and the medial aspect of the thigh, which can contribute to this condition. Also, when we're training or when we're competing, you think about what we call cutting, where it is a quick directional change. That puts a great amount of stress on the medial knee and the medial thigh. So we want to make sure that when we're doing these exercises that our body is prepared for it, that we've trained very hard and strengthened the muscles. Other factors can also contribute to Pes Anserine Bursitis. These are both intrinsic and extrinsic factors. An extrinsic factor, an additional extrinsic factor that can contribute to Pes Anserine Bursitis is what we call bursts, which are quick, explosive movements while someone is running. Done too much when the body is not prepared for it, this can be a contributing factor for Pes Anserine Bursitis. Also, intrinsic factors for Pes Anserine Bursitis, I've mentioned many of them before, but there's several more. One is actually obesity. When someone is overweight, that will put additional stress on the knees, and that can contribute to this condition. Also, anyone who has osteoarthritis of the knee, this can contribute to the Pes Anserine Bursitis. The knee is not functioning properly. It does not have that movement in the joint and the stability in the joint because of the osteoarthritis, so that can lead to the Pes Anserine Bursitis. This condition is common among athletes of all ages, but it is more common among younger athletes, or, as I mentioned before, someone who has osteoarthritis in the knee. Another factor that can contribute to the formation of Pes Anserine Bursitis is maintaining a squatting position. I already talked about repetitive squatting, but maintaining a squatting position. For example, a baseball catcher. This is very tough on the knees and can lead to several different knee conditions. Pes Anserine Bursitis is one of those. So anyone who maintains a squatting position, you always want to move as much as you can, stand up, stretch out the legs, break that static positioning, and take that additional stress off the knees. Hyperpronation is a biomechanical fault that can contribute to numerous conditions. Pes Anserine Bursitis is no exception. Hyperpronation is a biomechanical fault in the foot and the ankle that places additional stresses on the knee, especially on the medial aspect of the knee. It can contribute to the knock-knee position, what I had mentioned before. It can also contribute to multiple musculoskeletal conditions. Pes Anserine Bursitis is one of those conditions. So we always want to strengthen the entire kinetic chain from the foot coming all the way up to make sure that everything is functioning properly. The symptoms of Pes Anserine Bursitis are located right at the Pes Anserine. It is extreme tenderness, very, very tender to the touch. The pain is sort of like a dull pulling type of pain. There is swelling. Sometimes it's visible, sometimes it's not. Most of the time it is palpable where you get in there and feel it. Also, there's going to be tightness in these muscles, probably a little bit of soreness, maybe some tenderness in the muscles that attach at the Pes Anserine. So the muscles, you always want to make sure when we're stretching and when we're foam rolling that we target the muscles. Okay. Again, it is the sartorius muscle, which runs from right up here in the front part of the pelvis, coming all the way down. The gracilis muscle, which runs in the medial aspect of the thigh, and then the semitendinosus, which is one of the hamstring muscles. The symptoms of Pes Anserine Bursitis are aggravated by motions such as squatting, maintaining a squatting position, kneeling, lunges, prolonged sitting with the knee flexed. It could be with the knee flexed like this, or just with the knees flexed when the feet are down on the floor. That can contribute to the symptoms or that can aggravate the symptoms of Pes Anserine Bursitis. Also, side-to-side motions. Like I said, that's a contributing factor, but it can also aggravate the symptoms and make those symptoms worse. Cutting, performing explosive motions, those are type of things that can really aggravate this condition and make the symptoms worse. Just like any other type of musculoskeletal condition, we want to eliminate the extrinsic and the intrinsic factors that cause this condition. Again, let me say that correctly. In any type of musculoskeletal condition, especially an overtraining or an overuse type of condition, we want to eliminate the extrinsic factors and the intrinsic factors of that condition. That's going to help to prevent the condition, and it's also going to help to rehabilitate the condition. When we speak about prevention, if you have seen my other videos and you've watched them and you've studied them, you know that I like to preach prevention. Prevention is easier, it's faster, and it's less expensive than rehabilitation. And with Pes Anserine Bursitis, prevention is the key. There's many things that you can do to prevent this condition. First of all, I know I've said it several times on this video, strengthen the entire kinetic chain. Eliminate any biomechanical faults. We want to strengthen the feet muscles so that if there is hyperpronation, the effects of that are limited. We want to stretch and strengthen the hamstring muscles. We want to stretch and strengthen the medial thigh, and we also want to stretch and strengthen the anterior aspect of the thigh. Those are extremely important in preventing this condition. You can do that, stretch or strengthen these muscles with a variety of exercises. I had mentioned squats as a contributing factor, but when we're doing our squats to strengthen the medial thigh, you take a wider stance, you line up the knees and the feet in a sumo stance, and you do your squats that way. It's going to help a great deal to strengthen these muscles. Strengthening the medial thigh muscles. I know I just talked about this, but I want to repeat it because it's so important. You can use squats. Anytime you do squats and you are emphasizing the medial thigh, or basically the inner thigh, medial is the medical term, you want to use a wider stance. So you do the sumos, you do the sumo squats. When you are trying to prevent an injury, obviously you want to strengthen the muscles that need to be strengthened, but also you want to use a variety of stances. So the sumo squat should be the main type of squat you use, but then you do that for a certain number of weeks, then switch your stance, then go back to it, then switch your stance with again and go back to the sumo squats. Also, you always want to work through a pain-free range of motion no matter what exercise that you're doing. So when you're doing squats, your squatting depth should always be through a pain-free range of motion. We do not want to overstress the spine, the pelvis, the hips, the knees, or the ankle when we're squatting, or the muscles that move those joints. So we always want to make sure we're working through a pain-free range of motion. You can also do the adduction exercises, which are moving the thigh towards the midline of the body and towards the opposite side. Also do internal rotation exercises. Doing those motions are going to help to strengthen the three muscles that I mentioned that attach at the pes anserine and all the other medial thigh muscles, which are very important in preventing Pes Anserine Bursitis. Also, doing core strengthening exercises, strengthening the rectus abdominis muscle, strengthening the transverse abdominis, strengthening the gluteal muscles, especially the gluteus medius, because the gluteus medius is going to keep the pelvis level when we are running, especially when we're cutting, when we're bursting, or we're going side to side. So keeping these muscles strong is extremely important. So those are things that you want to think about when you are trying to prevent any type of injury, but especially if you're trying to prevent the Pes Anserine Bursitis, or if you're trying to prevent a reoccurrence of the Pes Anserine Bursitis. If symptoms should occur, you want to take action immediately. Do not hesitate. Now, if there's been a traumatic onset, those symptoms are going to begin almost immediately. If it's a non-traumatic onset, the symptoms are going to have an insidious onset. You're going to feel it a little bit, especially when you're training, maybe right afterwards, then the symptoms will lessen. But then they will return again once you start doing the aggravating activities. So you want to take action as quickly as you can. If you start to feel pain in this area, you can apply ice after the training. Put the ice on for about 10 or 15 minutes. Always make sure you have a thin towel or washcloth between the ice pack and the skin. No more than 10 or 15 minutes, then you take it off there. You can do that a couple times throughout the day, but you always want to be safe. You always want to make sure that you have a thin towel or a washcloth between the ice pack and the skin. You want to protect the skin. It's going to help a great deal to reduce some of that swelling. You want to remove the contributing factors, the extrinsic factors and the intrinsic factors. The extrinsic factors, you're going to have to modify your training. You're going to have to figure out ways to take away the motions and the exercises, take those out of your routine that are causing this condition. You're going to have to change your ergonomics when you are sitting and when you are sleeping. When you're sleeping, you want to, if you're laying face up, you want to have a pillow or a wedge underneath your thighs and your knees. This is going to help to take some of the pressure off the knees. When you're laying on your side, you always want to make sure that you have a pillow in between the knees. That is going to help to take some pressure off the knees and the hips. So those are some simple things that you want to think about. When you are rehabilitating Pes Anserine Bursitis, some very simple things that you want to think about. You want to avoid prolonged sitting, avoid prolonged squatting and kneeling. Those positions put a lot of stress on the knees, so you want to avoid being in that position for a long time. Also, I spoke about the sleeping positions. When you're laying on your back, have a pillow or a wedge underneath your knees and your thighs. The wedge will be underneath the thighs and the pillow will be underneath the knees. When you're laying on your side, have a pillow in between the knees. That's going to help a great deal. Also, seek professional care. Get the proper diagnosis. This is a condition that isn't as well known as some of the other knee conditions. So it's kind of puzzling to people. So get a professional evaluation and treatment. As a doctor of chiropractic, this is a condition that I see in my office. Many times I see this along with other knee conditions. So it's puzzling to the person who has this condition. So you want to make sure that you get the proper treatment. In chiropractic care, I restore proper skeletal motion. That's going to help to optimize the nerve flow and improve the function. If someone comes in with Pes Anserine Bursitis, I'm going to not only look at the spine, but I'm going to look at the entire lower extremity. Like I mentioned several times before, you want to strengthen the entire chain. I will perform chiropractic adjustments to the entire kinetic chain. So talking about the spine, the pelvis, the hips, the knees, the ankles, and the feet. That's going to help a great deal to restore the proper function and to optimize the nerve flow. In conclusion, Pes Anserine Bursitis is a painful and performance-limiting condition. Prevent this condition, do everything that you can through proper training. Eliminate the extrinsic factors and the intrinsic factors. If you do start to have these symptoms, take action immediately. Do everything that you can to eliminate the contributing factors to this condition. Pes Anserine Bursitis is a chapter in my book. Like I mentioned before, my book is titled Running, Maximize Performance and Minimize Injuries. Pes Anserine Bursitis is chapter 13, starts on page 82. You'll get a great deal of useful information on this condition. But like I mentioned, it is a serious condition. It is painful. It is performance limiting. Very, very frustrating condition for all athletes. You want to make sure that your knees are functioning properly, so do everything you can to prevent this injury. Do everything you can to rehabilitate this injury. Train hard, train smart, stay injury-free, and accomplish your goals. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Thanking you for watching my video, Dr. Ozello's Sports Medicine Report.